So anterior spinal arteries, two in number, joining each other to form a main trunk of the artery, which is providing blood to the medulla, the lower part of medulla. This is paramedian artery for the medulla, and the anterior median part of the spinal cord, and this blood supply of the spinal cord from the anterior spinal artery is reinforced by the rami from the ascending cervical, the posterior intercostal artery, and first lumbar arteries. The other branch, which is taking origin from the vertebral artery, is a big artery, and it is arising from the lower part of the olive. Olive is a prominence which is seen due to inferior olivatory nuclear complex in the medulla. So the inferior olivatory nuclear complex is forming a prominence known as olive. This is the anterior part of the medulla. This is the anterior median fissure, the pyramid, and the olives. So arteries are coming in this manner. And arteries are arising on the inferior end of the olive. The artery is remarkably tortuous. The artery is tortuous, running behind the rootlets of glossopharyngeal and the vagus nerve. Running behind the rootlets of the vagus and the glossopharyngeal. This artery is PICA. This is the largest branch of the vertebral artery. PICA. Posterior inferior cerebellar artery. The artery is posterior inferior cerebellar artery, running behind the rootlets of the glossopharyngeal and the vagus. So now number 9 and the 10, the vagus. reaching up to lateral angles of the lateral ventricle, lateral angles of the fourth ventricle. Then descending downwards on the inferior-lateral border of the fourth ventricle. And approaching the inferior surface of the cerebellar hemisphere near the vermis. Here the artery is dividing in its medial branches and lateral branches. Dividing in the medial branches and the lateral branches. The cerebellum is forming the roof of the fourth ventricle. So this is the inferior surface of the cerebellum. This is the inferior surface of the cerebellum. The artery is descending downward on the inferior-lateral border of the fourth ventricle and reaching on the inferior margin of the fourth ventricle and inferior surface of the cerebellum. This place is having a branch of the pica. This branch is choroidal branch and providing blood to choroid plexus of fourth ventricle, choroid plexus of the fourth ventricle, and also providing branches to the medulla. The medulla behind the olive and lateral to the hypoglossal nuclei. So this is long circumferential branch for the medulla. Behind the olive and lateral to hypoglossal nuclei, which is situated behind. So in this part also multiple branches are long circumferential branches for the upper part of the medulla. On reaching the inferior surface of the cerebellum, the artery provides branches. This is the inferior surface of the cerebellum. This is the anterior part. So in this part the artery is dividing in medial. These are lateral branches, ramify. These are to the vermis. These are medial branches and these are lateral branches. So anterior half almost of the inferior surface of the cerebellum is receiving blood from posterior inferior cerebellar artery, the pica, the posterior inferior cerebellar artery, the pica. A branch which is arising near the tonsil is entering inside the cerebellum and it provides blood to the dentate nucleus. So this is long tortuous branch of the vertebral artery. Now artery is ascending anteromedial now to the medulla and almost at the level of the pontomedullary junction, or between the inferior border of the olive and pontomedullary junction. Two vertebral arteries join each other to form the main trunk of the basilar artery. This is an example of convergence type of anastomosis. So other branch in the medullary region is the posterior spinal artery, which is arising from the posterior inferior cerebellar artery, or sometimes directly from the vertebral arteries. So the posterior spinal artery, this artery is dividing in anterior and posterior branches. Anterior branches of the posterior spinal artery are running anterior to the dorsal roots of the spinal nerves, and the posterior branch of the posterior spinal artery is running behind the dorsal root of the spinal nerve, and it is supplying to the medulla and spinal cord. Again, the branches are reinforced by the ascending cervical branches, the branches from the vertebral artery, and the branches from the posterior intercostal and first lumbar artery. So now we will talk about the basilar artery. Two vertebral arteries, in the pontine cistern. Two are joining to form the basilar artery. So this is the vertebral artery and this is the basilar artery. So known as the vertebro-basilar system. Vertebro-basilar system. The basilar artery is formed by the convergence anastomosis of the two vertebral arteries, and the basilar artery is running in the anterior median sulcus of the pons in the pontine cistern. In the pons, the basilar artery is giving multiple small branches known as the pontine arteries, maybe long, maybe very long, maybe short. A long artery in this region. This long artery is known as AICA, 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 anterior inferior cerebellar artery. We have seen already the posterior inferior cerebellar artery. So anterior inferior cerebellar artery runs backwards, and many times it exhibits a loop near the internal acoustic meatus, and if it exhibits a loop near the internal acoustic meatus, it provides other branch that is known as labyrinthine artery. Labyrinthine artery or internal auditory artery. This internal auditory artery runs with the vestibulocochlear nerve in the internal auditory meatus. Many times the internal auditory or labyrinthine artery also arise directly from the basilar artery. So anterior inferior cerebellar artery is providing blood to the anterior surface this anterior surface of the cerebellum. This posterior surface of inferior surface is from the PICA, and this is from AICA, anterior inferior cerebellar artery. So anterior inferior cerebellar artery is supplying blood to the inferior surface, the anterior part of inferior surface. The posterior part of inferior surface is supplied by the PICA, posterior inferior cerebellar artery. The anastomosis between the branches of AICA and PICA taking place on the inferior surface of the cerebellum. Before its termination, it is providing two big arteries. These are superior cerebellar arteries. Superior cerebellar arteries are arising just before termination of the basilar artery. This artery is running parallel to the terminal branch of the basilar artery. That terminal branch is known as posterior cerebral artery. So this is cerebral, posterior cerebral artery, and this is superior cerebellar artery. So these two arteries are running laterally and backwards parallel to each other, separated by in medial part by oculomotor nerve, separated by oculomotor nerve in medial part and trochlear nerve in lateral part. So this is oculomotor and this is trochlear. So this is superior cerebellar artery running backwards and laterally, reaching on the superior surface of the cerebellum and supplying blood to superior surface of the cerebellum, anastomoting with the PICA and AICA. So up to now we have seen the posterior inferior cerebellar artery. which is the main artery for the posterior half almost of the inferior surface of the cerebellum. The artery for the anterior half of the inferior surface of the cerebellum is anterior inferior cerebellar artery, AICA. The labyrinthine artery, which is arising from the anterior inferior cerebellar artery, sometimes from the superior cerebellar artery, sometimes directly from the basilar artery, or rarely from the PICA, also known as internal auditory artery. And finally, the superior cerebellar artery, which is the branch of basilar artery just before its termination in posterior cerebral arteries. So we will continue the posterior cerebral artery in the next lecture.